Hi, I'm Liz Crocket from Reach CNY. I'm going to talk to you today about the core mission of Reach CNY, two of our programs, and one of our big challenges for the present and the future. Reach CNY is an agency located in Syracuse, New York, that works to provide resources, education, advocacy, and collaboration to improve health and decrease health disparities in Central New York. Our agency was founded in the late 1990s, and it has always been focused on improving public health in the Central New York region. We have the core efforts are focused on activities to support public health. And one of the frameworks that we use is the spectrum of prevention, or you can flip it and call it the spectrum of promotion. And it recognizes that to make real differences in public health, you need to work at many levels of the system that we have, all the way from activities that help individuals and families to organizational policies. And here's where collaboration comes in as a major strategy, because no one agency or program can make real changes alone. And then also working all the way up to changes in local, state, and federal policies. Two programs we have that are built on this understanding are our adolescent pregnancy prevention program serving Onondaga County. It works collaboratively. We provide programming, and we also subcontract with the Salvation Army, Planned Parenthood, and Huntington Family Center, who deliver services to youth in the community. We use evidence-based approaches that have been found to work either through research or through practice. And these activities include an evidence-based sexuality curriculum and working with the community based on needs to improve services throughout the community. Our other program I wanted to mention is the Maternal Infant Community Health Collaborative. We work closely with Oswego County Opportunities in Oswego County. Our big challenge for the future is that our current funding hasn't built our agency capacity to the extent that we need to have full administration and a fund development program to support this programming. So our board is working hard on increasing capacity. Hi, I'm Liz Crocket, and today I wanted to tell you about a really exciting development in maternal child health that has provided opportunities for the agency where I work, which is Reach CNY in Syracuse. In maternal child health, there have been many challenges over the years, and there's been a lot of work that has led to reduction in infant mortality and reduction in the number of mothers who die related to pregnancy. One of the major developments in New York State since 1975 has been to develop a regional system so that high-risk pregnant women and their infants are transported to a regional center where really highly trained medical professionals are there to provide the type of care that women and infants need when they're very sick or there's a premature birth. This has led to a real decrease in poor birth outcomes. However, we still have very bad disparities between black infants and white infants. The new thinking, which has been around for many years, is that the beginning of pregnancy is too late to start to improve health. We need to work hard to make sure that all girls and women are healthy before they ever become pregnant, and that they're able to plan when they want to have their babies. This was hard to put into place when there was not good access to health insurance in the United States, but the Affordable Care Act is making health insurance and health care more available to women of all incomes. And it's part of a whole change in our health system, which we are slowly bringing in to focus much more on prevention and wellness, rather than the addressing of chronic diseases when they occur. Our agency is fortunate to have received funding from the State Health Department called the Maternal Infant Community Health Collaborative, where we are working very hard to be part of this whole system. And we are able to work with women of childbearing age, girls and women, to help them become healthy before they become pregnant, and then to help pregnant and parenting moms. We are really excited, and we know that by working with the State Health Department and the federal government, and by focusing on data to help us identify, in addition, specific strategies that work and see if the changes we make lead to improved data, we are all going to make a difference in the future.